the next time you need medical care, don't be surprised if you don't recognize your doctor. There's a new trend in healthcare providers. They're called hospitalists. So what exactly do they mean to you, the patient? Anita Vogel is live in our West Coast newsroom. All right, Anita, so first of all, what the heck is a hospitalist?
Well, hi there, Megan. Well, it's a doctor that appeared in the hospital about 10 years ago. It's become a lot more popular since then. These are full-fledged physicians who concentrate on medical care in the hospital. They take care of patients in the hospital. Again, they are full-fledged doctors who can treat most ailments, and then they also can go on to become a case manager if the patient needs to be seen by a specialist.
A patient who may come to the emergency room for chest pain. And so the hospitalist, again, will see the patient in the emergency room, coordinate the care with the primary care physician, and start, asking appropriate questions. Did the patient have an EKG before? Does the patient have risk factors for heart disease? And what they'll do is they'll gather the information and use that information to better begin the treatment of the patient.
And in fact, hospitalists are one of the most rapidly growing medical specialties in the country. There are now 30,000 of them practicing across the country, Megan.
So we're hearing now that these hospitalists are going to be very popular under the new health care legislation. What do you know?
Right. Well, one of the things hospitalists can do is to really help hospitals cut down on their costs because they're watching these patients from the moment they get into the hospital till they exit. So they can help cut down on costs by making sure tests and medicines are not duplicated. Also, that patients get treated essentially better and faster and perhaps even released earlier. Under the new healthcare legislation, hospitals will be penalized for readmissions and medical errors. So hospitalists can play a role in helping things run more smoothly. Now, if there is a downside for patients, perhaps when they're at their most vulnerable in the hospital, they'd like to see their own familiar family physician. But, those family physicians can't visit that often, only in the morning and at night. So hospitalists can be there 24 hours a day. Megan.
All right, Anita Vogel, thank you.
The number of them has mushroomed in hospitals over the last decade. They call them hospitalists, doctors who focus on round-the-clock care, following patients from admission to release straight through. Hospital officials say these doctors can more quickly tend to a patient's needs and also help cut hospital costs. But some patients say these hospitalists are like strangers who show up at their bedsides and they'd really prefer their primary care physicians. Anita Vogel is live in our West Coast News Hub this afternoon. Anita, what are the details here?
Well, hi there, Shepard. They started appearing in hospitals about a decade ago, and now there are nearly 30,000 of them practicing across the country. They are called hospitalists, and they are stepping in for the family physician when patients need them the most.
75-year-old Henry Clancy was brought to Providence St. Joseph Medical Center because he needed a specialist to treat an infection related to his pacemaker. For nearly 2 weeks, he's been under the care of a hospitalist, an MD whose primary focus is overseeing care while patients are in the hospital.
I treat patients with pneumonia, with heart attacks or chest pain, emphysema, kidney stones, anything from serious to not so serious. Doing well.
Dr. Gilbert Esai was Henry Clancy's primary physician during his stay, but also coordinated treatment from a series of specialists. Officials say case management cuts down on skyrocketing costs.
When you have a physician dedicated to the care of the patients in the hospital, there's less chance of error because, again, laboratories, tests, and patients are examined and re-examined sometimes several times a day, so there's less that could basically fall through the cracks.
Hospitalists also keep in close touch with the patient's doctor. A consistent presence, Henry says, helped him breathe easier.
I think he'll follow up on me real good. He seems like he cares. It's not just his job. I think he cares.
And studies show monitoring by a hospitalist can save healthcare providers up to 20%, but they're not perfect. Studies show they also make mistakes, sometimes failing to pass along pertinent information to the family doctor. And what patient wouldn't rather have the family doctor standing by their bedside in a perfect world?
As Fox National News reported, Regal Medical Group is on the cutting edge of healthcare. Regal Medical Group is an independent physician association, part of the Heritage Provider Network family, one of the largest healthcare providers in California.
Thank you for calling Regal Medical Group. How may I direct your call?
Regal concentrates on accountable, managed care, putting patients and quality healthcare first, followed by convenient access and affordability, assuming the risk from cradle to grave. Dr. Syed Hassan is Regal Medical Group's chief hospitalist.
Hi, Cynthia. It's Dr. Hassan. Hey, could you bring me the paperwork on the discharges today from St. Joseph's Hospital, please?
Working closely with doctors coordinating care. The Regal network spans more than 5,000 square miles in Southern California, including thousands of healthcare providers, 2,000 primary care physicians, 10,000 specialty physicians, and over 150,000 members. Giving back to the community is critically important to Regal Medical Group. In July, Regal sponsored a community healthcare dialogue luncheon event to offer neighbors an informal discussion on where we go from here after healthcare reform legislation passed. The event was co-sponsored by the North Valley Chamber of Commerce and the Santa Clarita Valley Chamber of Commerce. Over 150 guests listened to the influential panelists, including Dr. Adam Solomon, Assistant Medical Director, Regal Medical Group, Mr. Fred Bauermeister, Executive Director of the Free Clinic of Simi Valley, and Carrie Carmody, the COO and Interim CEO of the California Region for Providence Health and Services. The Honorable Assemblyman Cameron Smythe, 38th District, who is a member of the California State Assembly Committee on Health, moderated the panel.
The ideas in this bill is to bring up these organizational structures that will bundle payments and work together. What is the physician's interest? What could the physician be doing? What is the hospital doing? What could they do better? And once the patient's out of the hospital and in a skilled nursing facility or some other, or maybe at home with home health, all of that spectrum of care, again, what organization is going to look at that and try to manage it as best they can to improve the quality and reduce the costs? And again, Regal is one of the companies that's doing that, one of the reasons I came here.
How do you think the healthcare reform will impact our hospitals?
Are there enough acute hospital beds? Because what's happening is we're all aging, the baby boomers are all aging. We know there's a capacity issue. And how are we going to fund that? It costs $1.5 million per bed to build a hospital. So if you're building 200 beds, you can do the math. That's $300 million. Every piece of equipment you buy for a hospital is $1 million. Doesn't matter what it is. It's $1 million plus construction, which adds another $1 million to it. So as we go forward, how are we going to be able to fund and sustain our individual hospitals to meet not the need only today, but 10 years from now when we're all 10 years older and need some acute care?
As this unfolds between now and 2014, we're going to figure out how it affects us. There's going to be greater utilization in the future of community clinics by folks that have less access, the folks that fall between the cracks. Also, I think there's going to be emerging new technologies and new systems for delivering health care. And we're talking about technologies where you will be able to take a picture of a rash on your arm with your cell phone and email it to your doctor. The doctor can look at the rash and maybe prescribe, so there's no need to go to see a doctor in his office. So these kinds of things are going to come out, I think, in droves now.
The HPN family of medical groups, including Regal, is the only medical group in California sponsoring these vital community healthcare dialogues, letting the public know we are here to answer the tough questions the new federal and state legislation has implemented.
What a great event. I wish I could have brought my manager with me so that she could see what you guys are doing. This is amazing.
I think today's event was actually very helpful for the Assemblyman's constituents from Simi Valley. There's a lot of confusion, there's a lot of angst in regards to healthcare reform.
Getting the doctors and the health plans and so forth coordinated with the community is what we should be doing more of. Outreach.
As seniors, we feel that this is very important to us, and it answered a lot of my questions.
It was such a positive, informative dialogue between the panel and the audience that I feel very positive about the changes that will be coming.
What Regal does is that they're looking out for the best interests of the patients or the participants in their program. You know, there's not very many. I'm with another competitor, and they're not educating me on what's out there, what's to come.
And what's to come was discussed in the 4th Community Healthcare Dialogue in an ongoing series sponsored by Dr. Richard Merkin, Heritage Provider Network, and Regal Medical Group in October in Simi Valley. The luncheon event was co-sponsored by the Simi Valley Chamber of Commerce and the Simi Valley Hospital.
I want to welcome you today to an important discussion It's on health care reform. The federal government has passed the law.
Over 100 attendees listened to influential panelists, including Dr. Gary Hertzberg, medical director at the Regal Medical Group, Mr. Fred Bauermeister, executive director of the Free Clinic of Simi Valley, and Mr. John Beeman, the CFO of Simi Valley Hospital. The mayor of Simi Valley, the Honorable Paul Miller, moderated the panel.
Do we know what's going to happen between now and 2014 and what will change?
85% of the healthcare dollar as the baby boomers go forward will be spent in Medicare. So if you're not in Medicare, you're not in healthcare. So again, we have to grapple with managing a resource that's going to be absolutely necessary to care for the really the demographic change that we're all going to experience with the baby boomers entering Medicare.
According to the UCLA Center for Health Policy Research, in 2009, 21% of persons 64 and under living in Ventura County were without health insurance. So what does that mean for health providers and for the hospital?
About 15% of the people who come to our emergency room don't have insurance. So about 15%. So on the surface, it may seem that if this 15% now have insurance, that's a benefit to us. What I see as the greater benefit, though, is if the hospital and physicians in the community can work together better, we can probably keep that 15% out of the ER in the first place.
Fred, what has been your experience in the last, say, 3 to 5 years with regard to people coming to the clinic? Do you find that it is increasing? Is it backing off? What's your experience?
It's definitely increasing. Last year we saw 11,762 people last year, which is the most we've ever seen in our history. We expect this year to be somewhat similar, and probably the year after to continue at those levels. And the people that come to the clinic today are sicker than the people that used to come to the clinic. Like John said, you know, we're trying there to keep people healthy and consequently out of the emergency room for the hospital.
What's in the legislation is the idea that a group of physicians and other healthcare entities, a hospital, home health, etc., would manage the health care of a group of Medicare patients at a minimum size of 5,000 people. And so it would be very much similar to a Medicare HMO type model, except that it's going to require really physicians and hospitals and other providers to work together.
I think what they're all going to be called are ACOs. Look for that term, Accountable Care Organizations. I work with Heritage and Regal, and this is what we dedicate our time to.
Not only did the event generate positive feedback from the community, news coverage was positive as well. The Heritage Provider Network and its family of medical groups are the country's leading example of a successful accountable care organization. Giving back to the community through these important healthcare dialogues reveals HPN's commitment to providing superior healthcare from cradle to grave.